evening, good to have you with us in the 9 p.m. edition of the Urban Debate. There's a growing concern over the beneficiaries missing their second dose of the COVID vaccine in the country. Nearly 12 crore eligible beneficiaries across the country have not taken their second vaccine dose yet. Crores of people have missed the vaccination window by weeks, and that's why it's becoming a growing concern. For example, there are about 3.92, almost 4 crore citizens in our country today who have not taken their vaccine and are overdue by 6 weeks. So you have a gap between the first dose and the second dose, basis which vaccine you've taken. That window can be different. Now, once that window opens, post which you can take your vaccine, 4 crore people haven't turned up, and it's been 6 weeks since. There are about 1.57 crore people who are overdue for their second shot by 4 to 6 weeks. And then there are almost 3.4 crore people who are overdue for their second shot by 2 weeks. Half of this 12 crore number comes from the big 5 states. And that's why it's a very big concern for these states. States like Maharashtra, Uttar Pradesh, Karnataka, Tamil Nadu are the ones who are looking at a poor turnout for second doses. Now, this could mean several things, viewers. It could mean that the government went extremely aggressive in the first round, got people to take their first shot, but isn't going as aggressive to get them back for their second shot. It could mean that the people are not very well aware of the fact that you need, for good immunity against this virus, you need to take 2 shots. So in Uttar Pradesh, Bihar, Maharashtra, Rajasthan, Madhya Pradesh, possibly the governments will need to come out with specific programs to reach out to these people and get them to take their second shot. Tonight, we're going to talk about that. We're going to talk about what can be done and how big a concern is this number, 12 crore people. Niranjan L Shetty of the BJP joins me this evening. Krishna Hegde of the Shiv Sena joins us this evening. A Saravanan, spokesperson for DMK. Dr. Rajesh Parikh, Director for Medical Research at Jaslok Hospital, joins me this evening as well. And Dr. Rajiv Dasgupta of the COVID Task Force also with us this evening. Dr. Dasgupta, let's just first explain this, and honestly, we ourselves have a few doubts. We know that there are these windows, time gaps that have been fixed by the government. 1 month in case of one vaccine, 85 days in the case of second vaccine. But is there an end window by which you should take the second shot, or the first one becomes of no use?
Thank you. If we put it in the good, the bad, and the ugly terms, the good is we achieved 1 billion doses. The bad is this complacency emerging. And the ugly is the possible threat from the new variants that you presented a little while ago. And the relative comfort that we see in India, or rather in Indians today, is in view of the fact that we are in a post-Delta situation where the tsunami has come and swept things away, but there's a relative calm now. But all of this is relative. We know the immunity wanes, and particularly with the single dose, the schedule is just not complete. And therefore, the government has earmarked 2 tasks. One, to complete 90% first dose immunization by end November, and certainly to tackle this complacency. This is actually a quite tough job. At the same time, there are 2 or 3 positive points. One, because of COVID, we actually know who is missed. That's pretty easy to track today. 2, with our strong fundamentals in the immunization program, we have history of tracking, of mopping up operations, of effective social mobilization, particularly from polio and measles programs. So it's doable, but it's got to get done.
Yes, it is doable and it has to be done. And of course, you know, if we've managed to set up a system where we've managed to give 100 crore doses and are continuing with this program, we will be able to do it. But the point being that the focus needs to be redirected here. And that, Dr. Parikh, is an important point. Before we get to how we do this, just to add to what Dr. Rajiv Das Gupta was saying, 92 lakh people just in the state of Maharashtra, Dr. Parikh, haven't turned up for their second dose. Maharashtra, that was on top of the table pretty much throughout in terms of number of cases, cannot afford to let its guard down like this.
Of course not, Tanvi. And continuing on the same trend as Dr. Dasgupta, let's talk about the positive things first and then try and understand why we are not doing as well as we could have. First of all, historically on the positive side, no country in the world has had as tremendous a record in vaccination as India has with the smallpox and the polio campaigns. In fact, these campaigns are looked upon by the rest of the world as models for successful vaccination. And second, of course, the figure that everybody talks about, the 1 billion doses that have been given across the country, that's reason for optimism. And the reason for concern, as you have articulated, is the fact that a lot of people are not coming up for their second dose. Almost as much as 15% across the country were not coming up. Other than the reasons that you mentioned, I think one reason we need to factor in is the long gap in one of the vaccines, Covishield, between the first and the second dose. This is the longest gap in the world. In the United States, for example, where they're using the mRNA vaccines, the gap has been just a month. And, you know, Covishield accounts for more than 80% of the vaccination in the country. And when you have a gap, which is 12 to 16 weeks, the longest in the world, that sometimes does not stimulate people to come for their second dose. And of course, we've had the Diwali holidays and other things, and people tend to become lax. So there have been numerous factors why the second dose is not as rigorous as the first. But again, on a note of optimism, just a few days ago, for the first time, more second doses were administered in a day than first doses. So we're moving in the right direction. But as you said, we really need to step on the gas. We've done this in the past. And if we harness our experience of the past, we can still catch up and motivate people to take the second dose. I mean, when you look at just the Delta variant, forget the new variant, data is indicated that there is just 30% efficacy with the first dose. The second dose takes it up to 79%. And then the booster dose takes it up in the vicinity of 93% efficacy. I think we need to emphasize this to the people so that they don't have a false sense of security. They only have 30% protection with one dose, and then they are dangerous to themselves, to their families, and to people around them. So we really need to motivate people to take their second doses.
Oh, yes, absolutely. You know, since the phrase has become so popular these days, we come from two Indias. One India that constantly is pushing for a booster dose and lobbying for it, and one India that's not even bothering to turn up for its second dose to protect itself. That's the kind of diverse challenge that our governments are looking at right now. What can be done? That's the big question. Saravanan, let's start with you. Because Tamil Nadu has dealt with vaccine hesitancy. You know, we saw in the initial days itself, there was massive hesitancy. Now we're looking at the challenge of bringing the same people back to say, oh, come take your second dose.
Yeah, see, Tanvi, Tamil Nadu has almost achieved 76% of the population. They have they've got their first dose, and almost around just about 40% of the people, they have got their second doses. Now we are looking at bridging that gap. And now new mandates have come in the state of Tamil Nadu. In all the public places, only people who are vaccinated, who are double vaccination, who have double vaccination, they are allowed entry. And there's a big thing going on. New movies are being released, and people are getting their second doses before the movie, just at the counter, just near the box office, and they're entering the theater after getting vaccinated. And movie theaters, we are having vaccinations. So we are trying innovative methods, innovative steps to ensure that people get their second dose. See, they become little reluctant. Not even, I wouldn't say reluctant, they become complacent because the cases are on the waning side and they already have the protection of one vaccine. So they think that it might not really affect them and the second dose doesn't matter. I think the government will step up. They are stepping up. It will step up. Almost around 50,000 camps have been organized and 11 mega camps. In every mega camp, if you look at the state of Tamil Nadu, around 18 lakh, average of around 12 to 13 lakh people have availed the vaccines in every Sunday. Every Sunday there is a mega camp in the state of Tamil Nadu. So this is how the Tamil Nadu government is ensuring, and we are also having this home-to-home inoculation drive where the health workers go to the homes of all the residents who are unvaccinated and ensure that they get vaccinated. So there has to be a proactive approach.
Let me ask you this question. You're completely right. There needs to be a proactive approach. But what has really changed? The mega camps, the door-to-door approach was also there when you gave them the first dose. And if you're continuing with these camps and the same approach, then the people would have, why are they not coming forth for the second dose?
See, that's what Tanvi, complacency has set in. They think they don't need the second dose because, as I told you, the cases are on the downtrend. So there are not enough cases. I think people tend to forget the horrors or they block the horrors. What happened in April? I think if they just recollect what happened in April to their loved ones and dear and near ones, they will not hesitate. I think probably the governments all over the country has to remind people what happened in April. And we don't want such a situation. It is just complacency. And the government is, the thing is, they have to act. They have to run a fine balance between ensuring that the people get their vaccines and not over-alarm them. That is also there. So that is the issue. That is the issue the governments are facing. That is why we are not creating big alarm, but we are on the target. The health minister and the chief minister, they are on the job. The chief minister has mandated that he is very, very optimistic that by the end of November, the entire population of eligible people who can get vaccinated will get vaccinated, at least the first dose. And the second dose, it's going to be a little difficult, but the Tamil Nadu government will achieve it.
Okay, now let me bring in Mr. Krishna Hegde here, because the other such state, Maharashtra, which is facing equally big problem of people not turning up for their second dose, Mr. Hegde. Now, in cities, you can, like Saravanan said, in cities, you can still come up with conditions to say, we won't give you access to public places. Just like we have a rule for entry in mall, you need to be vaccinated, we'll put those rules everywhere else. But the problem also is in smaller towns and in rural areas, in villages. What will we do to reach out to those people? If they miss their window completely, then even the first dose will be of no use.
First of all, I must appreciate the good work done by our Honorable Chief Minister, Uddhavji Thackeray, and our Health Minister. And Maharashtra has been leading in administering the first dose as well as the second dose, considering the amount of population that Maharashtra has, that is close to around 11.5 crore people. Secondly, I must also say that on 21st of November, though our target was 30th November, on 21st of November, we completed 10 crore doses, whether it's the first dose or the second dose. 6 crore 80 lakh doses for the first dose. 6 crore 80 lakh people have been vaccinated with the first dose, and 3 crore 20 lakh people have been vaccinated with the second dose. So we completed a figure of around 10 crores by 21st November, which was our target was 30th November. So we are well within the target. Between this whole time, I can say that what Dr. Parikh said was very right. There is a gap of around 84 days between the first dose and the second dose as imposed by the central government, which is causing a huge problem. I think this is the highest in the world. And if this gap is reduced, I'm sure that the frequency of administering the second dose will also increase. Thirdly, we have to understand that apart from the fear factor which is going out, there were also most of the major religions had their festivals in this season. And because of which the people were busy, some had moved out of the city, some had moved back to the villages. And now since people have all come back, I'm sure that soon the frequency of the second dose will also pick up.
Mr. Hegde, let me point out one thing. You've listed out a few factors, and some of those factors are valid. But here is my very simple point to you. So, I didn't contest it when Saravanan listed out the steps they are taking, but I can very well say for what is happening in Maharashtra or not happening in Maharashtra is an aggressive campaign by the state. You know, the amount of push that was there, the number of camps that were being put into place, the kind of awareness, engagement that the local civic bodies and the state authorities were doing has dropped. People will forget if the government doesn't constantly remind them.
The government has again started Har Ghar Dastak. That is, go to every house and inform the people, give your dastak at every door and inform the people, make the people aware about administering the second vaccine. Secondly, also like you said, there are some communities who are shying away from the vaccine. We are also bringing in film stars to create more awareness, to speak to the people, to make them aware to take the second dose. After all, a life is very important and we know that we have to save lives. We have done immensely good work in this COVID. I think our Chief Minister Uddhavji Thackeray has done immensely good work during this COVID. And carrying on with this Mahavikas Agadi's work, I am sure that since the last couple of days, again the the second dose are also picked up,
right?
And we are administering quite close to 1 lakh doses a day. However, the target should be scaled up, and we shall soon reach 5 lakh doses a day for the second
so
dose.
there is a danger there when you step up and ramp up so quickly. And I will come to that in just a bit, because the policy that you use can be maybe incentive-based, more of pull-based, but it can't be when you start cancelling out people's basic access to food, a livelihood. And I'm going to come back to you in just a bit on that, because that's where Maharashtra is actually walking on very dangerous territory. Let me also bring in Mr. Niranjan Shetty. Mr. Shetty, it is the duty of the governments right now, the centre and the state. And unfortunately, I want to say this, while internally all governments are aware of it, you're not publicly making enough noise about it. You made publicly a lot of noise about the 100 crore landmark. We need to perhaps on the same level start making noise that please come back and take your second dose. India cannot let its guard down.
Absolutely. I do not disagree on this point. But having said that, if you see, there are many other states apart from Maharashtra which has almost completed their 100% doses. The neighboring state of Goa itself has completed their dose. What was the reason? They did a lot of mega events, which the Maharashtra government could have done. Just yesterday, I heard one of the RTI activists who found out through the RTI that of the 800 crores that was been collected under the CM Relief Fund, only 193 crores was spent, and that too 82 crores for the migrant laborers and 42 for sex workers. This brings a suspicion as to what exactly was being invested upon. As you suggested, the Maharashtra government, I am very happy what my friend Mr. Krishna Hegde said, that they are roping in the film personalities. We all know that at the initial stage, their leaders and the other allies leaders initially did not even take the vaccination. So this was the kind of approach they had when the central government, which is our own government, initiated of bringing our own Indian-made Serum Institute, which came up. They didn't even purchase the vaccination from the coffins which they had in their hand. So these are the kinds which, can be one of the reasons.
Mr. Shetty, I understand the political point that you're trying to make, but since you quoted the smallest state being governed by the BJP, let me also quote you the largest state being governed by BJP, which is horribly lacking, which is Uttar Pradesh. Its second dose coverage is only 29% right now, and Uttar Pradesh is going to elections in a few months. So they really need to buck up, otherwise it's a big challenge that we're looking at. I don't want to make this political. I actually want individual political parties and states to tell us what they are doing. But since you raised the issue, I will ask Mr. Hegde to respond.
It is a laughable matter that Mr. Shetty, my friend, honorable friend, is comparing a state with 35 lakhs of population with a state which has 11.5 crores of population. But I don't want to get into the politics of BJP. Similarly, I would also say that when most of the Maharashtra and Mumbai were not receiving vaccines, the Prime Minister was having a tikka mahotsav. I don't know what kind of tikka mahotsav was going on. And all the BJP MLAs from Mumbai were circulating figures and vaccines which were administering in BJP states in Karnataka and UP. So let us not get into all that. Secondly, what he said is regarding the PM relief fund, 200 crores were spent out of 800 crores. Now, if our honorable PM has spent 200 crores out of 800 crores and still managed to give the best of medical facilities, the best of medicines, the best of, and kept COVID under control in such a huge state like Maharashtra, where today the numbers are hardly 200, or in Mumbai 2 or 3 deaths, you can imagine that how much money of the taxpayers we have saved. So I think Mr. Shetty should appreciate that less money has been spent and more work has been done, then speak about it the other way around. And I thank you for telling us, I thank Mr. Shetty for telling us that only 200 crores is spent. So therefore, you must appreciate the good work done in so much less money, Mr. Shetty.
Okay, so now let me ask you this, Mr. Hegde, because there is a dangerous path that the Maharashtra is headed down. Aurangabad and the local administration in Aurangabad has decided that they won't give ration. They have begun to seize auto rickshaws of people who've not taken their vaccine shots. They're refusing to give ration or fuel to people who've not taken their vaccine shots. Rather than campaigning, spreading awareness, pushing people to take it, can we cancel off their basic rights? I mean, I don't see anybody telling rich people, don't go to a movie theater if you don't have your 2 shots. Luxury is being given, but basic necessity is being taken away.
Yeah, I'm not aware of this episode, but if something like this is happening...
Yes, then I would request you to bring it to the attention of the Chief Minister, because the government sources seem to indicate that they feel if the Aurangabad model works, they will replicate it elsewhere, which is lagging in vaccine coverage.
Tell you that Aurangabad has got a MIM member of parliament, which is Mr. Imtiaz Jalil. And what is he doing there then? If he cannot represent his people, and if he cannot fight for the rights of the people, then what is he doing on the chair?
But the order is coming from the local administration. And it is the responsibility of the state government to know what's going on and to stop it.
The local administration is telling people, I would request the local administration also to bring in more awareness and not take away their food grains.
In fact, Mr. Niranjan Shetty, this is a very tempting thing to do. And a lot of local administration and state governments are actually bringing it in places where the vaccine coverage is low. Just to shoot up your target and your numbers that have to be achieved, you can't tell people we won't give you food. We will cancel off your ration under the government scheme if you don't get your vaccine. Governments have to find better ways, take some effort in increasing the vaccine coverage. Mr. Niranjan Shetty, to you,
I fully
Madhya
agree.
Pradesh is
And
also doing
on the same page as that of you.
Yeah.
Now, yeah, I fully agree. I'm not dissenting from the facts. Irrespective of the states, whichever state is doing, it is very unfair on the part of the people, especially the common people. But having said that, it is the responsibility, as you rightly pointed out, it is the local authorities which needs to have such kind of, people like what I said, the understanding, like you cannot debar all such people from the food grains. It is very irrespective of the states, whichever it is doing. Personally, I feel that I do not know.
But yes, because all states are doing this, and when you don't make it a state government thing, but a local administration, it's easier to hide it or not talk about it. But it's problematic for the poor people who are being denied food or a source of livelihood. And Saravanan, it's a very fine line. Even when you say that for public places, we'll make it mandatory, I'm sure you know, Saravanan, it's the poor people who get more affected than those who have access to all the basic necessities.
Yeah. See, Tanvi, that is agreed that it is the have-nots, the underprivileged people who will be affected by such mandates. But we don't have a choice. See, the gap is startling. it's 76% first dose and 46% is the people with 2 doses. The gap is almost 30%, and the data suggests that in India, only in India, this gap is so huge. Everywhere else, it's around 80% and 70%, 80%, 65%. With the gap, the difference between the first dose and the second dose. And now this is probably because India has the largest gap between 2 vaccines, 12 weeks to 16 weeks. This is the largest gap anywhere in the world. Probably since we are having vaccines, enough vaccines now, probably the union government should ensure that the gap should shrunk still more, probably 8 weeks. 8 weeks, everybody says it gives a robust response. Robust antibodies are produced after a gap of 8 weeks. So this timeline, this 12 to 16 weeks timeline should be brought down to 8 weeks. Then we'll be able to fill up the gap. And probably union government should think in those terms also. Because now, for anybody, any government, state or union, when you say vaccination, the priority, or they would tend to prioritize the first-time vaccinators. Because they will think, at least let them get one protection of 1 dose. So the second dose, it's like they, especially with such a huge population. So this is one way where we can address this. And the data also suggests that, and definitely we'll have to come up with innovative ways and incentives. See, rather than penalizing people, probably we should incentivize them.
That's what I'm saying. But it's a very dangerous territory when you start enforcing such rules, which will impact one segment worse and more than the other segment. Incentivizing, campaigning, spreading awareness, just how you convince them the first time around to come and get the vaccine. We cannot feel tired. The complacency isn't just amongst people. There shouldn't be any complacency amidst the officials, amidst the local officials, the local district administration that needs to go out there and do the whole thing one more time. Dr. Rajiv Dasgupta, since this has been raised multiple times here, is that something that the government can look at as a policy? As a scientist, would you say, yes, maybe we can shorten the gap and that could help?
Let us not conflict two different things. The scientific basis of the schedule, taking a relook at the schedule, that's one aspect. But that's not going to solve this problem overnight. Let's not conflate these two things. We knew the rules of the game when we had a 12 to 16-month schedule. Let's not forget that. The point is that umpteen health programs have shown that disincentives, coercions don't work. The fact is, in the overwhelming response in COVID, particularly with some of the legal provisions being in place, has been what's known as securitization. And what we see in some of the examples that you gave is actually some examples of that securitization. And the fact is that health sector is one sector where strongman leadership is rarely fit for the purpose. Occasionally it may work, but that's not really the desired model. And it's well known that health sector leadership development actually works on negotiation, flexibility, and relationship building. It's not about strongman leadership.
So what would you suggest that the governments right now do, or the local administration, civic bodies right now do?
So one is that the program should be allowed to work with time-tested strategies, which are not the coercive ones. Time-tested strategies are what we have done in Mission Indradhanush, which generically is called periodic intensification. So essentially what we need here are some of those periodic intensification strategies, of which the Mission Indradhanush is a very good example, including the intensified Mission Indradhanush. The state governments, the local governments, and the central government has always worked together. There has been a lot of synergy across nearly 24 sectors where in a whole of government model when the Mission Indradhanush works. I mean, those rounds are held. So there are all these models laid out. Let us not try to invent something and do something magical about this complacency. There are rules of the game. We need to deploy those and not get onto very novel ideas and implement them with a very strong arm.
Okay, Dr. Parikh, do come in on the first part here, since you raised the issue of shortening the window. Because many experts believe we are already at the far end of that window. It's already the most stretched for us. And now we run the risk of having people who don't turn up for 6 further weeks. And thereby, you know, lose the time where they should be getting their second shot.
Tanvi, I completely endorse the idea of reducing the gap. As Dr. Dasgupta has pointed out, just that is not going to work. We need a three-pronged approach. But absolutely, I mean, this is the longest gap anywhere in the world. We had other reasons, compelling reasons for having that gap. Those reasons don't exist anymore, and we need to go by the science of it and certainly reduce this gap. That will help. In itself, it won't resolve the problem. There are two other things I suggest. The second is to get NGOs involved. This has worked brilliantly in the past. You know, when the WHO conducted the Polio Plus campaign, it got NGOs involved. It got the Rotary Club involved. And getting NGOs involved will certainly help. I can give you one example of where we got an unbelievable 102% penetration in the Polio Plus campaign. I had to relook these figures myself because I couldn't believe them. And, you know, this was an area that I had taken charge of. It was the E ward in Mumbai. It covered the commercial sex workers. And we were very concerned about ensuring that all of their little babies got Polio Plus. We desensitized young students. These are college students, St. Xavier's College, HR College. We told them you're going to deal with people who society doesn't normally respect, but you'll have to treat them with enormous respect. Are you ready to have a cup of tea with them? Are you going to talk to them and do everything you can? And then when I looked at the numbers, they were 102%. It was just unbelievable. And then I realized what had happened. You see, the Bombay ST depot in Bombay Central fell within our ward. And these young people had enthusiastically, on their own incentive, gone to the bus depot and started administering polio drops to children who were either getting off the ST buses or getting on them. They had gone beyond the call of duty. We exceeded that. So we need to get NGOs. We need to get young people. I mean, a lot of ossified policies, a lot of ossified people pushing this campaign. Let's get young people with enthusiasm involved in it. But finally, Tanvi, I do believe that we do need some kind of a mandate, not a coercive mandate. For instance, yesterday was the last day that a government employee in the United States could show up to work if he didn't have both doses. And in fact, I was in New York 10 days ago, and I met a senior government employee who happened to be an anti-vaxxer. So we had a discussion, and he told me in a very resigned way that it's a choice between my job and taking this stupid vaccine. So I've had to take it. So I think some kind of a mandate, not coercive, not affecting basic rights, needs to be put in. Let us not forget, Tanvi, and this is completely lost in the debate and the polemic, that people who are not vaccinated are dangerous. They're like bioterrorists who are, instead of shooting bullets, shooting viruses at all of us. And there is a considerable overlap between people who are vaccine deniers, who do not wear masks, and do not maintain social distance. It's a large intersection in these three circles. And these people, in my opinion, are like bioterrorists. They're a danger to themselves and to society. We do need some kind of a mandate to ensure that they get their second dose.
But though, you know, I would just add to that to say that a lot of them in our country aren't doing it by choice, basis understanding or education or awareness. They're actually doing it out of lack of awareness, and they don't understand why it's required. Where the differentiation lies between those who may not be queuing up for their second shot in our country versus the vaccine haters in, you know, many of the Western nations who think that they know it all and then they understand it all and they don't need it. So that is where the approach also perhaps needs to be different. I am out of time, but Saravanan, you wanted to make a point?
Yeah, Tanvi, I think the government should also think about vaccinations for people below the age of 18. See,
absolutely.
What the information from Europe and England is that the unvaccinated, unvaccinated teenagers, they are mainly responsible for the rising COVID cases now there. Now we are opening up schools, colleges aggressively. So I think the government, I don't know why the government is not looking into this aspect at all. The union government especially. So I think they should look into this and ensure that they are also getting the protection of the vaccines at the earliest.
Oh, yes, absolutely. And I think they are. And in the coming weeks, we will definitely hear about the plan of how the rollout is going to happen. who will be the preference even in that age group, at least between 12 and 18, and that policy is expected to come out soon. We also have to know that we are moving towards a direction where we are also normalizing international travel and more international flights. We are opening up schools, colleges, workplaces are pretty much all open, markets are pretty much all open, domestic travel is pretty much back to normal. And if these are the conditions, then we cannot afford to let our guard down. I thank the panelists for joining me on this conversation, but I cannot emphasize on this enough. Please go and take your second dose if you haven't yet and you are eligible. You're already at the far end of the window, so you must go and take it when your time comes on the date which is there, or maybe if not on that day, a few days later. But we've come a long way in this fight, and we don't want to go the way many of the countries across the world are headed, where another wave is back, where countries are going into lockdowns again, countries with good vaccine coverage, countries with lesser population density than ours are getting back into lockdowns. They're shutting down their borders again, and we don't want to head in that direction. Yes, the commentary from the government is that perhaps the third wave won't be as brutal as the second wave. Irrespective, do we even want to consider the possibility of our hospitals getting overburdened again? Of any of our people, our loved ones, getting infected again? And the only way we ensure that that doesn't happen is by masking up and getting vaccinated when our turn comes. We are slowing down with our vaccination pace. The pace that we showed in the month of July, August, September, we have slowed down. November has been far below what the previous months have shown in terms of number of people getting vaccinated. So not just the problem of second dose beneficiaries not turning up on time, but even the first dose ones are slowing down. And the governments need to wake up to that and not take it so lightly. The complacency isn't just in us, it is, but it is also in the governments. And we all need to collectively get back on track. Thank you for joining us on this conversation.